The Munich Security Conference concludes today in Munich, Germany, wrapping up 3 days of high-level discussions on global security, geopolitical tensions, and emerging international challenges. This year's gathering brought together world leaders, defense officials, and policy experts amid growing concerns over conflict, global health security, and shifting alliances. To discuss health security, let's unpack this further with CEO for World Health Summit, that's Carsten Schicker, who joins us now on our video link. Thanks so much for your time this hour. Let's just first get your broader reflections on the conference so far. I mean, it brings together some of the greatest minds in one roof.
Good morning from snowy Munich. We had 3 very busy days with world leaders gathering here in Munich. Discussing security, but as we know, security is not confined to the topic of defense. It spans across several sectors, and I was particularly pleased to contribute to the discussion to see what health systems, which role health systems play in the broader security context. If we look at conflicts, wars happening right now in the world, we see that healthcare facilities are deliberately being targeted. That is clearly against humanitarian international law, but apparently it is happening, and it is not, let's not be fooled, it is not collateral damage, it is strategy. This is the sober reality we are facing right now.
Yeah, and like you say, health security isn't just a health sector issue. It's a security and resilience issue at the same time. Now, the strongest defense against shocks is a health system that's accessible, that also can be trusted and can be able to scale up fast. Just how are some of the conversations there faring insofar as ascertaining that goal?
What many people realize here that for too long we have looked at the sectors of health, defense, civil protection in a siloed way. And that approach is clearly not working anymore. We need to look at them on a systemic level. For governments, that means you need to think about security and resilience, societal resilience in a systemic way. You need to bring together these actors, and you need to broaden your approach beyond government. You need to include the other sectors, you need to include the private sectors, you need to include the civil society, because health and healthcare systems are vital to the stability and prosperity of our societies.
And here's the thing, many conversations are also steering towards finding out how do we move about pandemic preparedness, hybrid warfare, including attacks on hospital infrastructure. For example, in Berlin, to bioterrorism, health needs to be integrated into modern security and defense planning.
Yes.
Just how do we bring all those great minds then to come have these conversations? Because this is a global conversation that needs not to end.
Absolutely. I'm really glad that basically I could spend all Friday and most of Saturday talking with leaders from all these different sectors. We ourselves had a dinner with ministers and military personnel and humanitarian actors to discuss these very topics and to move forward. And I feel there is a sense of urgency, and there's a sense that we need to collaborate more. We will take on that discussion, especially at our own World Health Summit in Berlin in October. It's a dialogue that needs to continue, and we need to move, obviously, from dialogue to action.
And I like that you mentioned that, because it speaks to us not just making such conferences merely about talk shop, and just moving along after that. Something really needs to come out of it. Now, from, Ukraine, Gaza to Iran, in today's armed conflicts, health systems have become far too deliberate targets in a way. Just what are you hearing on this front in terms of mitigating all of this, but also just ensuring that we have people that benefit from these health systems that are supposed to be looking out for them?
I think we have to realize that war has changed. So NATO planned always for a war that was short and had very few casualties. The reality we see, especially now in Ukraine, is that it It's quite different. And it is, I said that before, it is strategic that Russia attacks healthcare facilities because they provide the very fabric of a society to be resilient. And wars nowadays are not so much maybe about gaining territory. It is really about eliminating societies on a physical and cultural level. This is what we are seeing, and healthcare facilities are prime targets for that, not only for conventional warfare, but for systemic hybrid attacks, and that's what we are seeing. So the best deterrence against these threats is obviously making your health systems resilient. If your adversary understands that your health system can withstand these attacks, there's a lower risk that they will be actually attacked.
And Mr. Schicker, as the CEO of the summit itself, I think, the real work starts after you are done with debriefing your various teams, after, you are done there, but also the real work and the test of everything that is said under that roof there is usually tested when it trickles down to the ground where it matters the most. How are we going to be testing the success of the summit or the outcomes that were discussed extensively at the summit?
What we need is political action. We see that happening, especially in Germany. The Federal Ministry of Health is already on its way to enact better laws for the structural resilience we spoke about. But I think we need a whole of society approach. We need to elevate that topic to the broader public. We need that people understand that investing into health is investing into security, in their very own personal security. So there's lots of communication to be done. Nowadays, health in many countries is seen as an expenditure. People want to be healthy, but they don't want to talk about health. We need to make them aware that investing into health is for their own benefit, for their own security, for the stability of their society.
But here's the thing, healthcare is becoming more and more expensive, for some of those, that little percentage of people that can afford to get a medical aid, it usually just covers only just the basics. Can you tell us about some of the conversations that you've been having there around this to make sure that we have healthcare systems that work for the benefit of its people, but also just moving towards health systems that talk to the needs of the people on the ground? What are some of the conversations that are being had there around this?
That's a conversation we also had at our last World Health Summit in Berlin in October. The problem we are facing in global health with the cuts that we are seeing is quite obvious and quite tragic. We see real casualties happening, and health systems, especially in low and middle income countries, are really strained. But I think what we see are approaches that could help. You need to move from thinking and acting in a verticalized way where you try to eliminate certain diseases to creating health systems, and that starts with primary care in many countries. Too often politicians want to be seen opening hospitals because that gives good pictures, but what is actually more important is to have accessible primary health care across the country, and that is especially community health workers play a vital role there. So I think it is up to many countries and also regional initiatives to strengthen the very foundations of their health systems. Yes, that also requires money, but I think we need to rethink how we spend the money on which level.
Carsten Schicker is the CEO for the World Health Summit. I must thank you so much for your time and insights on the program. All the best as you wind down the summit there.